Hey guys, it's Dean. Welcome to the Better Man podcast. In today's episode, we explore what men need to know about their 50s. If you're not there yet, hopefully you're going to get there one day. If you're already there or you're already beyond there, this is still going to be some really helpful information. In order to do this, I bring back Dr. Judson Brandeis, a sexual medicine urologist who has dedicated the second half of his career in medicine to optimizing manhood. He is extremely knowledgeable and experienced when it comes to helping men with their longevity, physically, sexually, and otherwise. In this episode, we discuss the three things you need to know about entering your 50s as a man, why muscle is so important to maintaining our longevity, why you're not safe from heart disease, which is the number one killer of men, even if you're relatively healthy, 9 simple practices to help you be healthier than 95% of other guys out there, and the only medically proven technique to increasing the length and the girth of your penis. I'm not joking. So, whether you're already in your 50s, whether you've already passed them, you're going to be there later on, I know that this is going to help you with your longevity. There's a lot of really great information in here. And as always, Dr. Judson Brandeis is a great guest to have. So, I hope this episode inspires you. I hope it gives you some useful information and inspires you to be a better man. Hey guys, it's Dean. Welcome to the Better Man podcast. Today I am joined by Dr. Judson Brandeis, who is a repeat guest. Dr. Judson Brandeis is a board certified urologist, surgeon, medical researcher, and physician educator. He focuses on sexual wellness or sexual medicine, I believe is the right term. And we had actually, I think, one of the most popular episodes ever on the Better Man podcast when he joined us last time. And today we're going to specifically focus on health for men in their 50s, things that we need to know as guys get older. I know many of you guys listening in are in this specific demographic, and we're all going to get there, hopefully, one day if you're not already. So, Dr. Brandeis, thanks again for coming, and I'm really looking forward to this conversation.
Oh man, it's an honor to be here. I love being on your podcast, and I love doing your yoga programs. It's as I get older, like I'm coming up on 56, like I told you, it's really important to incorporate those kind of things into your daily routines and shift. It's interesting. I have a body composition analysis scan, and I talk to my patients, especially my guys over 50, and shifting their physique. So a lot of guys come in with what I call a beach body. So their
Mhm.
arms are big, their upper body, their torso is big, and their legs are weak. And as you get older, you need to start beginning to prepare for your 60s, 70s, 80s. And if you want to maintain that quality of life,
Mm.
you need to begin to work on flexibility, on balance, and building your lower extremities, your legs, your core strength, and your arms become much, much less important. So I talk to my patients about going from a beach body to a T-Rex body.
Okay, T-Rex body.
T-Rex is with a little arms.
That's the new aspiration for men over
Yeah,
50. Are
yeah,
you a
they're
T-Rex
T-Rex
body?
body.
That's funny. Yeah, ideally you are not skipping leg day at the gym. The sooner the better, it sounds like. So today I think it'd be cool to talk about. You mentioned, and we've had a lot of conversations. We've done some work together. You put out this really awesome book for men's health, the 21st.
21st century man.
Oh yeah, there it is. Look, right in the photo. 21st century man.
Yeah, there you go.
And from this, you've kind of distilled 9 things that can make you healthier than most men. And I'd love to get into those. They're things that I was glad to see that I mostly do pretty well, I think. And I'd love to talk about them kind of in the context of, you know, men in their 50s. But I think a good starting point here, what are some of the biggest concerns that you see guys in their 50s, changes that they're noticing coming in to see you about their health?
Yeah, I mean, the first thing to consider is that men's health is a total disaster,
Okay.
right? So 100 years ago, women lived 1 year longer than men. Now women live 5 years longer than men, right?
Mm,
I mean, that's a big change in 100 years.
yeah.
Second of all, the longevity of middle-aged men in the United States is actually declining and was in decline even before COVID. And the reason
Mm,
for that was alcohol, opioids, and suicide.
Wow.
right? What we call diseases of despair. So, I mean, think about that. In quote civilized society with increases in technology, longevity should increase, but longevity is not increasing, and
Mhm.
these are self-inflicted ways of dying: alcohol, opioids, and suicide. And part of it also is that men are half as likely as women to go to the doctor, right?
Mhm.
So, and part of the reason for that is that women are much more integrated into the medical system because they have babies.
Mhm.
So, by definition, they have to go to an obstetrician gynecologist because they're having babies. So they have a doctor. And then a lot of times women are more likely to take their kids to the pediatrician. And
Mhm.
so they're more integrated. They don't they actually know where their health insurance card is. They might know that if they have a PPO or an HMO. Like I had a guy the other day, he's a PhD scientist at Lawrence Livermore Labs, shooting missiles out of the sky.
Mhm.
He's got, I think, 2 or 3 PhDs. And I was like, do you have an HMO or a PPO? And he's like, I don't know. What's the difference? I mean, this guy's like,
Yeah.
you know, triple doctor certified, but he doesn't know the simple difference between an HMO and a PPO.
Yeah,
And so,
I don't know if I could explain that either, and my wife does handle the health insurance, so that jives with me.
yeah. And so, I mean, if you're a reasonably healthy guy, you're probably not going to need a doctor for until you're 40 or 45 or 50 years old. But, after 50 and especially after 60, if you look at, it's really interesting. If you look at the world record for the 100-yard freestyle or the 100-yard dash in running, or really any sport, the times are fairly stable until the age of 60,
Mm,
right? So the difference between the world record holder for the 100-yard dash at the age of 60 and the 100-yard dash at the age of 20, fairly similar. But after 60, the slope changes,
mm,
right? And you begin to decline much, much faster. And then at 80, there's another break point, right? And
mhm,
these are like top athletes in the world, right? So they're training for 3, 4 hours a day, and they have masseuses and physical therapists, and they're eating right, and they're sleeping, and so on and so forth. And so, I mean, Jim Morrison said, no one gets out of here alive, right?
mhm,
So we're all going to die at some point. But what you want to do is you want to get as close to that elite athlete decline curve, right? And
mhm,
most of us aren't on that curve. So instead of declining at 60, we decline at 50. Or if
mhm,
you're not taking care of yourself, you decline at 40 or even 30. I mean, I have lots of heart to heart talks with guys in their 30s about, you got to lose 20 or 30 pounds and you got to start exercising, because it's not going to get easier. Every
mhm.
year, it gets harder and harder.
Yeah. I we get a lot of people, in 50s, 60s, 70s in manful yoga, and so when someone comes to me and they say, Dean, I'm 52. I don't know if this is right for me. Or like, I don't know. I think it's all over for me. I'm like, no, man, you got a long time. You're young. You're relatively young. You've got a long time before like things
Yeah, I
really
mean, I'm
start
just
to.
flashing back to Animal House. Remember that scene at the end of Animal House? And he's like, "Do you think it's over? Nothing's over until we say it is."
Yeah, it's been a
What we
while
need
since I've seen
now is a stupid and futile gesture.
that.
Maybe you're not as big a fan of Animal House as I am.
I've seen it. I've seen it once, and
Oh
and
gosh.
it was yeah. I'm gonna have to be honest and say that was the Animal House of my time is old school. I
Oh
think
yeah. I guess I'm older than you are. Yeah. Go back and review Animal House.
I will. I'll ask my yeah.
Yeah. But nothing is
I'll ask
over
about it.
until we say it is.
Yeah, and I think that a big point of me saying that, like, I think guys in their 50s, like, it really hasn't. I see so many people who are being strong in their 60s and 70s that they're and there's this and there's also just this big idea that age is the not just the correlation, right? But it's like it is the most important thing in terms of your health and wellness, and they think that they can't strength train anymore, or like weights are bad beyond a certain age. Um, and it's, yeah, I hope that we can change that perception, and show guys
Well,
that.
I mean, you have to be smart.
Right.
The thing
Yeah.
is, like, I tell my patients, to build muscle in a 20-year-old, send them to McDonald's and send them to the gym. Right.
Yeah.
It's easy to build muscle when you're 20, right?
Hmm.
But over 50, like I have the Brandeis MD male rejuvenation protocol, right? And my focus is building muscle and burning fat, right? And I educate my patients about it's not weight, it's your ratio of muscle to fat that you're really working on. And
Mm,
so, a critical aspect of that for anyone over the age of 50 is get your testosterone checked.
mm,
Testosterone in men is getting lower and lower every year, right? Because we're relatively sedentary. We don't have to kill our food. We can
mhm,
just go to an app and have our food delivered to our house. And so, the statistics are that testosterone globally is about 30% less than it used to be. And testosterone helps you build muscle. It's the most important growth factor in men. It helps you build muscle. It helps you get rid of fat. It helps your libido. It helps your
mhm,
cognition. It helps your sleep. I mean, testosterone is like the perfect growth hormone for men. I mean, anyone
mhm.
with a bat and two balls is going to do better with higher testosterone than lower testosterone, and it's very, very safe. There
Yeah,
are
we
very
had a
few.
we had a really good conversation about this on the last episode that we did, and initially me coming into the idea that of testosterone replacement therapy, I was kind of coming into it thinking like, well, what if they just like change their lifestyle, right? What if they just start living a better lifestyle? What if they start eating better? What if they start managing their stress? What if they start sleeping better? Then and exercising, then their testosterone will go up, right? And the answer that you gave me, which kind of surprised me, was, well, maybe not. Maybe they actually do need to get testosterone therapy. Kind of the whole chicken before the egg, argument here.
Yeah, I mean, the thing is, if
Um,
your testosterone's like 150, you don't feel like going to the gym.
mhm,
So, for some of those guys, especially my younger guys, I put them on testosterone with the hopes that one day I don't need to have them on testosterone anymore.
mhm,
And if you take something like Clomid or HCG, then you can support testicular testosterone production, and you don't lose that production once you go off testosterone. And so sometimes people just need like a little jump start, a
mhm,
year of testosterone, and then they've lost 20 pounds, they've built muscle, they're sleeping better, uh, and then you can transition them off of it.
mhm. Yeah, that's cool. And that's another myth that you need to, once you're on it forever. So I think that's a big reason. I think a lot of guys are resistant to medical intervention, and they don't want to, there's other types of guys, right? There are some guys who are like, give me all the surgeries, give me all the medical intervention. But then there are guys who are like, I don't want to take any sort of medication. I don't want to get reliant on something. So knowing that, this could potentially be a temporary intervention and not a forever one.
Yeah.
I
Or,
think that's
sometimes
something
like
to know.
for guys whose fertility is still an issue, I'll just put them on Clomid or HCG.
Mm,
And you get a testosterone boost from those medications. And that's not giving someone testosterone. It's more like overstimulating
mhm,
their production that they have already. But, that's one of the major things that declines in men after the age of 50. And so that's something it's not what we're taught in medical school to check, right? It's not a standard thing that people check, but it's one of those interventions. Like we check a whole bunch of labs for like no reason.
mhm,
Like we check chloride, we check CO2, we check all these things that you get like we check neutrophils, we check so many things that are just basically useless
mhm,
because there's some variability, and we don't check testosterone, which is something that actually declines, and it's something you can actually do something about.
mm. What
Anyway,
are
sorry, I get fired
no,
up about these things.
you do. You must have good testosterone levels. I would
Yeah,
hope.
I do.
That's good. Um,
Yeah.
I'm curious about other things. So what are some other things that happen to guys in their 50s? Testosterone, one thing.
Yeah, I
What are
mean,
some
so
other
you
things?
get a reduction in human growth hormone and IGF-1,
Hmm.
insulin like growth factor. So, all of these things that are telling your body to um, grow and improve are winding down. Another thing that winds down is endogenous production of nitric oxide. Nitric oxide is a really important neurochemical in your body that's released by nerves onto blood vessels that open up blood vessels. And I actually produce a supplement called Affirm that's a nitric oxide booster that helps boost circulation to the brain, to muscles that a lot of elite athletes, and especially endurance athletes, take these. It improves penile circulation, works synergistically with Viagra and Cialis, and even decreases blood pressure. So, you know, you get what's called sarcopenia, which is just a fancy medical term for a reduction in muscle
Hmm.
as you get older, and it has to do with a reduction in neurochemicals um, like nitric oxide. It also has to do a reduction in growth factors like testosterone, IGF-1, human growth hormone. Also has to do with nerve dysfunction, right? So your nerves aren't working as well. It has to do with mitochondrial dysfunction. It has to do with um, a breakdown in DNA. It has to do with um, you know inflammation in the gut. You're not absorbing proteins. That has to do with the way that you eat. There's a whole host of reasons why you lose muscle as you get older. And so between 40 and 60, 40 and 70, you lose about 1% of your muscle mass per year. And after 70, you'll lose about 1.5 to 2% of your muscle mass per year. And that's your quality of life.
Hmm.
If you can't walk upstairs or you can't get out of a chair, or you can't walk around, then you can't travel, you can't play with your grandkids. And so what I tell my guys that are in their 50s is you got to be preparing for the 60s and 70s and 80s if you want to have a good quality of life. For me, it's not about lifespan. It's not
Hmm.
about how long I live. It's about health span. It's about how healthy I can be into my 70s and 80s. And I'm turning 56 in June, and I'm really totally focused on building muscle
Hmm.
by 60.
Yeah.
At the age of 60, I want to have as much muscle as I possibly can, knowing that whatever I do, it's going to start to decline at a
Mm.
faster rate.
Hey guys, I want to give a quick shout out to our featured brand this week, Chubbies. They are giving 20% savings when you use the link in the show notes to shop at chubbies.com. This is the brand that I have personally been using since 2011. Back then, they only did casual shorts, short shorts, which I loved. And then they started making swimsuits. From there, they started making workout shorts. Now they make t shirts as well. I am a fan of all of them. I love the casual shorts because they are as free moving as workout shorts. I can actually squat down, I can play around in them, I can work out in them. The swimsuits are super fun. They get a lot of attention whenever I wear them out in public. And the workout shorts are really fun and they're comfortable and effective for workouts as well. So, again, I hope you can take me up on this offer. Use that link in the show notes for 20% savings. And skies out, thighs out. That kind of leads me to the next question is, we can it sounds like there are things that we can do that we should be able to maintain as we get older. But what are some things that happen in our 50s that are things that changes that we should kind of respect and accept? And what are, as a result of those changes, what changes do we need to make to our lifestyle?
Yeah. Well, first of all, there's some actually real medical stuff that starts happening at the age of 50, right? So at the age of 50, you should probably get a PSA check, right? It's just a lab test to look for the possibility of prostate cancer because,
Hmm.
after the age of 50, especially if you're African American or especially if you have a family history of prostate cancer, you can get prostate cancer. Um, at the age of 50, should get a colonoscopy
Hmm.
or do at least a stool test for blood or for cancer cells, right? Because colon cancer happens, and it happens after the age of 50. You should get a full checkup with a full set of labs, right? Maybe not in your 30s, maybe not in your 40s if you're just doctor phobic or you're adverse to going to the doctor, or you think that you're invincible and you don't want to have health insurance, right? But at the age of 50, you really need to go to the doctor and have a full checkup with full labs. I mean, I personally, I get a full body CAT scan every 5 or 6 years, right? Because I've had patients and I've had friends show up with all sorts of weird, unexpected cancers, and I just don't want to ever have to have that kind of surprise. Um, and so, at the age of 50, get check in with a doctor, please.
Hmm. What are some
You don't,
reasons? I was going to say, what are some reasons that you think men are avoiding going to the doctor?
men think they're invincible. Men are all taught, be strong, tough it out,
Mm-hmm.
that whole kind of messaging that we all get, and a
Hmm.
lot of us buy into it. That it's a sign of weakness to go to a doctor, to go to a therapist, to go to anyone that's in the business of trying to help improve you.
Mm-hmm.
But that people are there to help you,
Mm-hmm.
and not to judge you, and really take advantage of that, because that's super critically important.
Mm-hmm. Yeah, you know, I don't know if I go to the doctor as much as I used to because I'm just in I moved away from the hospital system that I was in when I was growing up, um, and then I had bad health insurance, so like going to see a doctor wasn't fun. I think I had I might have much better health insurance now, and I do have a doctor, but I normally go to him for if I need antibiotics. I'm like, okay, I've had an infection for like a week now. It's been 2 weeks. It's time for my my biannual antibiotic dose. Um, but I think a big reason I don't go maybe as much as I should. I mean, I think even my age, my health, I think I should be going at least once a year, at least once a
Yeah,
year.
well, maybe,
Just to,
or maybe every other year is probably
okay,
fine. I
all right.
mean, that maybe flies in the face of what doctors say, but I mean,
Mm-hmm.
if you're a young, healthy guy, there's not a
Mm-hmm.
whole host of stuff that's going to go wrong.
Yeah,
But
and that's kind
at
of my thought.
50, yeah, I mean, at 50, stuff does start going wrong. I mean, I had a patient the
Mm-hmm.
other day, right? So I treat a lot of guys for erectile dysfunction. I have a whole host of things that I do for them: low intensity shockwave therapy and PRP and Affirm, and but if it doesn't work, my radar goes up. So I had a patient the other day, 52-year-old guy, like built, like, strong guy, works out 5, 6 days a week.
Mm-hmm.
And everything that I was throwing at him really wasn't working for erectile dysfunction, right? And
Mm-hmm.
erectile dysfunction is a precursor for cardiovascular disease, right? So it's about 10 years from the time you develop erectile dysfunction. So if you start using Viagra, Cialis, that kind of stuff, um, you need to be cautious that you are developing cardiovascular disease. And so I sent this guy, as I send a lot of my patients, for a heart calcium score, right? It's a super simple test. It's just a CAT scan of your heart. It takes literally 1 minute, costs a couple $100, right? His heart calcium score was 1200, right? My score is 0. I guarantee you your score is 0, right? At 1200, this guy could keel over at any minute and die,
Wow.
right? Just to give you an example, because people don't really understand the numbers. My brother-in-law is 53, right? He's got a strong family history of heart disease, and he wasn't feeling great. And so he went to his doctor, who ordered a heart calcium score. His heart calcium score was 800.
Mm-hmm.
They sent him to the cardiologist, who called up the cardiothoracic surgeon, and he had a 6 vessel heart bypass 3 days later,
Wow.
right? With a heart calcium score of 800. So I told my patient, because he's a Kaiser patient, the Kaiser was like, "Oh, well, we don't really believe in that. You should get a stress test. We'll schedule it for 6 or 8 weeks from now."
Hmm.
I told my patient, I mean, he's a smart guy. He's a great job. I said, "You go to the cardiology office at Kaiser at 9 o'clock in the morning, and you sit there until somebody sees you. So I don't want you to leave that office without being seen that day."
Mm.
Right. That's what a heart scan of 1200 means. But that, if you looked at this guy, you'd be like, "Oh, that guy, he's buff. He looks like he's in great shape." You would never know that he had a ticking time bomb inside of him. Right. So for guys over 50, the first sign of cardiovascular disease in a quarter of men is death.
Mm. Wow.
And it's not unusual for me to have these kind of patients.
Yeah.
This is the guy that came in 2 weeks ago, but I mean, I have dozens and dozens of similar stories.
I used to think a few years ago, I think I used to think that as long as you worked out regularly and you ate well and you slept well, that you'd be healthy. And now I'm learning, like, okay, there are some other things at play here. And stress is way more important than we thought it was, or at least, maybe intuitively some other cultures or some other
Hmm.
medical practices or medicine practices understood the impact of stress and other lifestyle things. And we also know now that our social life is way more important than, and you and I talked about this, but the Harvard longevity study proved that
Yeah.
the most important thing to our overall health and happiness is the quality of our relationships, more than like what we eat or sleep or like our
Oh
working
yeah.
out, you know.
There's an
And
amazing TED talk on that from the curator of the Harvard longevity study. So it was a study that was started over 75 years ago, and they took like 1,000 Harvard students and 1,000 guys from kind of rough neighborhoods in Boston, and they just followed them, and they followed every aspect of their life. You know, their labs, their health, their X-rays. Famous people like John F. Kennedy Jr. were in that study, uh, and they compared the health and the happiness of all these folks, rich and educated and poor and uneducated, and the number one thing that determines happiness and a healthy good life is the quality of your relationships, your close relationships and your friend relationships.
mhm.
And
Wow.
that's a challenge a lot of
Yeah.
times to maintain those relationships, especially, I'm married, I got 4 kids, I have 3 companies. It's hard to maintain a work-life balance. That's why there's a work-life balance chapter
Hmm.
in my book. It's hard to maintain those personal connections and to give time to relationships when you're trying to build businesses and you're trying to stay in shape and you're trying to be, X, Y, and Z.
Yeah. And that's kind of what I want to ask you about. And I also, so by the way, heart disease or cardiovascular disease, is this still the number one killer of
Yeah,
men? Okay.
that's number one.
What do you think is causing, if we look at, I'm assuming that that we can look at, well, what's causing heart disease in your opinion?
Yeah, I mean, well, we sit down and don't do much all day,
Hmm.
right? I mean, most of our occupations are sedentary. We're not farmers anymore.
Hmm.
And then the quality of the food that we eat. Obesity. I think by 2030, half of the country will be obese.
Wow.
I mean, that's just insane. And the quality of the food that we eat, it's high cholesterol, high fat,
Hmm.
um, and people aren't exercising as much as they used to be. But there's a big divide. There's people that are educated and informed and motivated, and those people are living better and healthier than ever.
Hmm.
And then there's the rest of the folks that their testosterone's low and they're overweight and they have bad habits. They're drinking, they're on opioids, they're smoking, not as much anymore, thank God. But um,
Hmm.
it's just like the cell phone, right? Some people use the cell phone to accumulate knowledge and become really informed and educated and so on and so forth. And some
Hmm.
people use it to play Angry Birds.
Hmm. Yeah. So I'm curious about because I have is high blood pressure and heart disease, are these two things related?
Yeah, I mean, I can sort of explain to you what high blood pressure is.
Yeah, because I know
Uh,
it's it's something that I know a lot of people who are really fit, active guys are they're they look healthy, and then they say, oh, I've got high blood pressure though. So I guess I'm kind of thinking you could be fit and you can be like you look like you're in physically great condition, but if you have high blood pressure, what does that mean?
Right. So your heart's a pump, right?
Hmm.
And the job of the heart is to pump blood all throughout the body. right? And when you pump, you create pressure. And there are about 50,000 miles of blood vessels in our body. Half are arteries, half are veins, right? Arteries have muscular walls. And when the heart pumps, it sends that blood into the elastic muscular walls of blood vessels. So the blood vessels will stretch, right? That's called the systolic blood pressure.
Mm-hmm.
And then because there's muscular walls, the arteries pump, they push the blood. And when the blood is pushed out, then you have a diastolic blood pressure, right? So you have a high number and a low number. The high number represents potential energy, right? Because it's stretched, and the low number represents kinetic energy, right? Of the blood flowing through, right? And when the heart is pumping, what determines the pressure is one, how hard the heart is pumping, but second, and more important, is how wide or narrow are the blood vessels that it's pumping through,
Mm-hmm.
right? So if you think about a hose, right? If a hose is running freely, it's a low pressure when the water is coming out. But if you put your finger over the tip of the hose, then that water is coming out of the hose at much, much higher pressure,
Mm-hmm.
right? Lower flow, but higher pressure. And so your body has two places that it detects blood pressure. Okay. One is your neck, right? You have this thing called the carotid body on the carotid artery, which goes up to your brain. And that has a sensor because if you lose blood pressure to your brain, then you're dead.
Mm-hmm.
Okay. The other blood pressure sensor in your body is in your kidney, right? Because your kidney monitors electrolytes and it monitors fluid balance. And so it's really important for your kidney to know and to get blood pressure. So those are the only two places in your body that really matter. If you're not getting good blood pressure to your fingers or your nose or your eyes or your liver, your body doesn't care. It's
Mm-hmm.
all about the brain and the kidneys, right? And so when the brain and the kidneys are saying, I don't have enough flow, then what happens? Your heart starts to pump faster, the heart starts to pump harder, and you get what's called vasoconstriction, meaning that the blood vessels in the rest of the body, in all the parts that you don't really care about, except the carotid and brain and the kidney, those will dilate, right? And that's what causes the higher blood pressure is the narrowing of the arteries that makes it harder for the heart to pump blood where it needs to go, right? So what causes narrowing of the arteries? Well, first of all, cholesterol, smoking, because smoking damages the endothelium or the inner lining of blood vessels, um,
Mm-hmm.
blood clots. But another thing that causes narrowing is stress, right? Because what's stress? Stress is a response to danger, right?
Mm-hmm.
Stress is running away from a bear, right? When you're running away from a bear, all your peripheral arteries are clamped down and you get blood flow to your muscles, to your heart, to your eyes, and to your brain, right? And all the other blood vessels are constricting, they're becoming more narrow, right? Now, if you're stressed at work, or if you're stressed in your marriage or stressed in some other way, your body only has one system, and that's adrenaline and cortisol. Those are your stress hormones. So whether
Mm-hmm.
you're running away from a bear or you're chronically stressed at work, your body's producing adrenaline and cortisol, which is
Mm-hmm.
narrowing those blood vessels. And so, in order for your heart to get blood flow where it needs to go, the heart has to pump harder, which raises your blood pressure.
Mm.
Does that make
So
sense?
yeah, so basically you could be in really good physical shape. You could be doing all the things, you could be eating well, you could be sleeping well, you could be exercising, but if you live a lifestyle in which you are chronically stressed, that means that you're going to have high blood pressure. That means that you could be at risk. I mean, does having high blood pressure mean that you're at a higher risk for heart disease? Does it mean that you could have a heart
Absolutely.
attack?
Because it means your
Um,
blood vessels are more narrow and it means your heart's working harder. right?
Hmm.
I mean, the heart has a warranty on it, 70,
Hmm.
80 some odd years. But if you make it work harder,
Hmm.
it's just like an engine in your car. If you're driving on the city streets, your engine's not going to last as long. You maybe get 30 or 40 or 50,000 miles out of it. If you're driving easily on the highway, you might get 200,000 miles out of that engine.
Hmm. My dad
The
had
other thing
a
is,
my dad had a teacher in medical school who used to say that your heart only has a finite amount of beats, so you shouldn't exercise because
yeah, I hope
you know,
I
no,
hope he didn't take that class for too long.
no, I think it was definitely a joke.
Oh, okay.
Definitely a joke, but yeah, it was just his justification for not he didn't want to exercise. So I think he's probably a really healthy he was probably a really happy healthy guy. Honestly, he was one of those um, again kind of indirectly proving what I'm trying to say here, which is that your physical health is not as important as whether or not you're just a happy guy.
Well, I mean, there, that's multiple factors, and genetics also plays a big factor.
Yeah,
I have a
like
lot
to what
of.
extent does that help? To what extent does genetics play a factor in high blood pressure? Like if my grandpa, for example, he had a heart attack when he was 64, I think, and I don't really know him that well. I
Mhm.
think he was, from what I understand, he was maybe a bit odd, I guess is the right term. One way to describe it. I think he had his own business, so he was a vet, and I don't know if he lived a relatively stressful life or if he had like a stressful childhood that went with him into his adulthood. But I kind of, I look at him and I'm kind of curious, like, well, if he had a heart attack when he was 64, was that, to what extent is that genetics and how is that going to affect me? And to what extent is that he just had a really stressful lifestyle? Um, and he, kind of grew up in the era of, just be a man and do what you need to do. And you're, different time, right? So, like, to what extent is that the factor? And so, yeah.
Yeah, but I mean, there are also certain ethnic groups, like for example, because I'm in Northern California, and there are a lot of South Asians, a lot of Indians that come over to code for Google and Facebook and Oracle and all the companies that are in our area. So I have a ton of South Asian patients, and the cardiovascular risk of an Indian guy is similar to a white guy with diabetes.
Mm,
It's pretty amazing.
wow.
They just have smaller blood vessels. In fact, I had a patient a couple months ago, young guy, like 47 years old, came in with erectile dysfunction. Um, I do this whole sort of eating lifestyle, building muscle, losing fat kind of thing with my patients, in addition to sexual medicine stuff. And I said, you need to get a heart calcium score because you're too young to have these issues. And so he actually was exercising and eating better and trying to lose weight, doing all the right things. And one day he didn't show up for his shockwave therapy appointment for erectile dysfunction. And 2 days later, we got a call from his wife, said, "Oh, he had a heart attack."
Wow.
We're like, "What?" So the patient came in like a couple of weeks later, and he was riding his bike like I told him to, and he hadn't gotten his heart calcium score, but he was smart enough to remember that when you have some chest pain, call the doctor. And so he called his wife. He got taken to the local hospital, and they ended up putting 2 stents in.
Hmm.
Right. And his main risk factor, I mean, he was 20, 25 pounds overweight. He was relatively sedentary. He had some stress in his life. But his main risk factor really was he was South Asian.
Hmm.
And so, there are families, there are Caucasian families, African American families that have early heart disease. And a lot of those folks I'll recommend getting a heart calcium score on. South Asians, I'll recommend getting a heart calcium score. African Americans, for whatever reason, have a much higher incidence of high blood pressure. So, you know, it's really important to know your numbers. I mean,
Hmm.
it's super simple to get your blood pressure checked.
Hmm. Wow. Um, it was making me think that also, I think people who people who I think what I the specific example I'm thinking of is Japanese people. I think when they lived in Japan, they had this higher life expectancy. They had, a certain way of living their life. They had certain diet. They had, and then moving to the United States, I think they had like a much. I think the lifestyle change is what, just the different food, different um, different movement throughout the day caused them to have a dramatically uh, lower lifespan. And so there's a lot of, at least back when I was like kind of more involved in this world, there was this movement to figure out what your ancestors were eating, right? So that you could eat based upon your genetics. I don't know if that's just what I thought of when you were talking about that.
Yeah, I did. There are a bunch of companies now that do sort of genetic testing and then give you nutritional recommendations based on that.
Hmm.
Um, to be honest, I didn't really find it super valuable.
Okay.
Yeah,
Yeah.
there's just the thing is there's a lot of low hanging fruit out there. Like a lot of us are like searching for these like miracle cures or like great epiphany light bulb moments. I had a patient that flew in from Florida to see me all the way out in California, and he wanted to talk about like peptides and all these like stuff that you'll hear on like podcasts.
Hmm.
And I looked at him and I'm like, dude, you got to lose 50 pounds. It's like, forget the peptides. Stop eating so much and go to the gym. It's
Hmm.
like really a simple concept. If you lose 50 pounds and you're going to the gym and you want to get to that next level, we can talk about, you know, BP57 and PT141 and alpha 1 antitrypsin and all these peptides that are out there. But most of the stuff is actually pretty simple. I mean, if you're doing yoga for an hour a day, you're going to get yourself into great shape. You're going to feel a lot better. Throw some meditation on there. Um, and that doesn't cost anything.
Hmm.
And you're not taking a foreign substance and putting in your body. So, I mean, most of the stuff that's out there for people is actually pretty simple. And most of it is, the Beatles said the best things in life are free.
Hmm.
And I would agree with that. The best things in health are actually free.
Yeah. And I think this is a good time to go into your nine things to make you healthier than 95% of men. And I think we did this on the last podcast. So I'm going to sum it up, and then I'll ask some questions about this. But no drinking, no smoking, no hard drug use, don't overeat, exercise daily, stretch daily, meditate daily, and be nice to people.
And sleep.
Um, and sleep. Ooh,
Sleep.
sleep,
Sleep is
very
super
important.
important.
Have you read Why We Sleep? Have you heard of that
No,
book?
I
Or
I haven't.
Matthew Walker? Matthew. Anyway, that was a book that was super popular a few years ago, and that for me was like, whoa, sleep is important, and the difference between
Yeah,
6 hours of sleep and 7.5 hours of sleep is incredible.
is
Um,
big.
so my question to, because a lot of the things that we're talking about, like, there's a reason why guys find it difficult to change their diet and go to the gym more often. There's a reason why guys are dying sooner because of substance use. What do you think are the reasons why men are turning to substances to cope with life as opposed to, you know, dealing with the issues themselves?
Yeah, I mean, my own personal theory is that we have outrageous expectations for life.
Mm,
Right. And that's informed by what we see on TV, what we see on the internet, what we see on Facebook, what we see on TikTok. Everyone's beautiful. Everyone's got a perfect life. Everyone,
mm,
gets along. Everyone's got, a Lamborghini and a French bulldog. But I mean, that's just not the way that life works. I mean, I see some really high end patients where if you look at these guys, you'd be like, oh man, these guys they got all their shit together. But you know what? I know their dirty little secrets.
mm,
And you know, everyone's everyone's not everyone's life is messed up. But I mean, just focus on your own life.
mm.
Don't set your expectations for life based on what you see in a magazine or the internet or TV.
Comparison
Um,
is the thief of joy.
Yeah, I mean, like I felt bad for, was it Brad Pitt, the pirate? When he was in that lawsuit with that Amber Heard.
Oh yeah, Johnny Depp
Yeah.
and that thing.
Johnny
Yeah.
Depp. Johnny Depp. Yeah, yeah. Sorry, I'm not good at celebrities, right? Right. So, like, I mean, here's this like really good-looking guy, and he's got tons of money, and he's got celebrities, and he's, there's like women waiting by the courthouse with signs and stuff like that. But this guy's life is so messed up, right?
Hmm.
Like you could hear the recordings of the fights that he was having with his wife or girlfriend at that time, and I'm like, man, I wouldn't trade my life for his any day,
Right.
right? So I mean, but you would look at him and or Arnold Schwarzenegger, right? I mean, like the guy's a legend, whatever. But he slept with his maid, and
That's true.
he's got a son floating around out there. Um, you know, everyone's life has problems, and
Hmm.
so don't set your expectations based on what you think life should be like or what other people's lives are quote like. Just focus on your own life and doing what you need to do the best you possibly can, and
Hmm.
hope for the best.
Yeah. So I want to ask some other questions about some of those nine things. Which I've got my own tips, but like, what are your recommendations for when you tell people they need to exercise daily? What are the tips that you give them to like, here's how you can start getting into a habit of exercising daily?
Yeah, perfect. So I do ABC,
Hmm.
right? I try to do simple things. A is for ambulate. So on day one, walk, run, treadmill, elliptical, something on your feet, stairmaster,
Hmm.
and I go by the American Heart Association recommendations, which is get your heart rate 220 minus your age, and then I usually ask people to get about three quarters of that, right?
Hmm.
So if you're 60 years old, 220 minus your age is 160,
Hmm.
right? And then you divide that by three quarters, you get 120. So get a heart monitor. They're cheap these days. Try to get your heart rate up close to 120 while you're exercising, right?
Hmm.
And if you exercise for an hour, you burn 500 calories, right? Because I ask people to count calories. So that's A. B is bike. So get yourself an exercise bike, get a heart rate monitor, get your heart rate up. You can do
Hmm.
some high intensity interval training on a bike. Bikes are really nice because they're not stressing your, you don't get stress fractures from a bike. And
Hmm.
then C is circuit training. So, you know, get a whole bunch of different exercises, squats, leg lifts, abs, biceps, triceps, and then just do it in rapid succession and do it with high reps, low weight, right? Because as you
Hmm.
get older, after the age of 50, your tendons and ligaments dry out. And so you're much more likely to tear or mess up, strain a muscle or a ligament than you are when you're younger.
Hmm.
You watch I've been watching masters track, right? You watch these 50, 60, 70-year-old guys at the starting line kind of jumping up and down. There's no springiness to their legs. You watch
Hmm.
these 20-year-olds, they're just like bouncing on pogo sticks. It's amazing. You lose that elasticity, right? And
Hmm.
you got to understand it takes 2 to 3 days to recover from a hard workout. That's why you don't want to run 2 days in a row or bike 2 days in a row. That's why it's ABC,
Hmm.
because it's day one, day two, day three, and then you recycle back to day
Hmm.
one, day two, day three. And then also understand you got to sleep because muscle building happens when you sleep. You
Hmm.
got to take a nitric oxide booster because you got to get blood flow to those muscles. I put a lot of my guys on creatine, right? Just a
Hmm.
little bit of creatine, like maybe 2 grams before, 2 grams after a workout, right?
Hmm.
They all have to get heart rate monitors, and they all have
Hmm.
to eat high amounts of protein, right? You can't build muscle out of carbs.
Hmm.
You need protein. You need amino acids to build muscle. So 80 to 100 grams of protein. That should
Hmm.
be the cornerstone of your diet if you're over the age of 50.
Hmm.
And
So
that's sort of the strategy that I implement with people.
yeah, are there any other supplements that for guys over 50 that are really important that can be super helpful? Like chondroitin is one. Glucosamine. I'm thinking of the
Yeah,
ones that have been
honestly, I'm
proven to
really
be
not
effective.
super familiar with that data. I
Okay.
mean, glucosamine and chondroitin are basically used to make cartilage,
Hmm.
but how that gets from the GI system to the cartilage, I don't know.
Hmm.
You would intuitively you would think, well, if you take it in orally, it's going to somehow get into the blood, and if it's in the blood, then somehow it's going to get into the cartilage. But I don't know how that pathway works.
Mm. Okay. Meditation daily. So that's one. What are your do you tell people, this is how I meditate and this is a way that you can do it, or do you say go find a meditation practice? Here are a few examples, or how do what does meditation look like to your recommendations?
Yeah, I mean, I do maybe 2-3 minutes of meditation. That's it. I
Hmm.
wish I knew more. I wish I did more. Um, there's a book that I read called Search Inside Yourself. It's about one of the early employees of Google. And now
Hmm.
like Search Inside Yourself is like a whole institution that they've rolled out outside of Google, but it's basically like mindfulness for engineers and scientific types.
Mm.
And what I just do is I try to take 5 or 10 breaths without any thoughts intruding into my brain.
Hmm.
And that's really hard to do.
It's incredibly hard.
I mean, it
Very hard.
sounds like so simple. Just take 5 or 10 breaths, and all you're doing is just focusing on breathing, the air
Hmm.
going in, the air going out, and just clearing out your brain. And it's, for anyone out there that's never meditated before, I challenge you to try to do that. And
Yeah.
you'll find that it's incredibly difficult. It's also a really, really good way to put yourself to sleep. If you're
Hmm.
having trouble sleeping, just entirely focus on breathing and try not to let any thoughts get into your consciousness, and and it can be really tough to do.
Yeah, I've heard meditation described as like flossing your teeth or brushing your teeth. It's just something that you do before bed. Um, and speaking to how difficult meditation can be, one of the most difficult meditations that I've tried is just being present and listening to sounds and being aware of the things that you're being aware of your senses and not being aware of thoughts. So if you really want to challenge yourself with meditation, go outside at night and like sit on your porch or like sit somewhere, close your eyes and just all you do is pay attention to the sounds, like listen to like the cars driving by a mile away or like maybe a bird chirping or something, but only focusing on like the sounds and not letting thoughts come up. And I'm like, I get 1 minute into that and I'm like, okay, I'm done, that was hard.
Yeah, and it's interesting. Like my wife and kids watch the Today Show every
Hmm.
morning, and it's like I watch the opening credits of the Today Show, and it's like every 1 second they flash a new image.
Hmm.
It's like it's unbelievable.
It's
Like
down to
the
a
assault.
science.
Yeah, I mean it's just an assault on our senses. No wonder we're all stressed out.
Yeah. I mean, you know, I have a son. Well, I have a daughter now too.
Oh,
But
congratulations.
thank you. But we watch like, we've gone through Coco Melon phases, which is like if you're a parent, it's this awful TV show with songs that sounds like they were created by Chat GPT. Um, but the animation is like they know what they're doing. They know that they're supposed to use certain colors. They know that they're supposed to change the scene every X amount of seconds so that it keeps the children engaged and it works. Like you could put a child in front of Coco Melon for, hours and just leave them and like they would still be watching it because people understand how to captivate your senses. And I think as long as we're talking about things that are making people less healthy, for me, I think the ability to focus, the ability to be with your thoughts without stimulation, because it's so easy to stimulate your thoughts, is something that is dramatically hurting our overall health. And it's even like a really good example of this is like looking at movies, like you and I were talking about. We're talking about Animal House before. Go watch Animal House and then go watch like a movie, uh, a college fraternity movie from like this year, and you'll see how much more engaging the newer movie is, like how much more quickly the scenes are changing, the different, like the lighting, just like the effects. And, we have less, it's even apparent in movies how much less focus we have in movies today versus like movies that were created, in the 80s. It's crazy.
Well, and also, if you watch old TV shows, they're actually really engaging because they had like real characters and real dialogue. Whereas a lot of the stuff today, it's just special effects and scene changes and colors and that kind of stuff. I mean,
Hmm.
it's fun to watch those old movies. That
Yeah.
really like it was a craft.
But for many people, it's going to be a challenge to have the mindfulness to watch an old movie
Yeah,
because
exactly.
it actually demands focus as opposed to like watching, I love Marvel and I love Captain America, but those movies are easy to watch because they are just extremely stimulating.
Yeah.
So I wanted to ask a question about, that we talked about this Harvard longevity study, the importance of relationships. What are tips that you give to people to improving the quality of their relationship?
Oh gosh, I'm not an expert at that. Uh,
Yeah, that's
my tip would be
that's
find an expert.
it's an area of opportunity for me as well. Yeah, definitely an area of opportunity. Um,
Yeah, it's like there's in my book, one of my friends who used to be the president of the California Psychology Association, Robert Bonfiglio, wrote a
mhm,
chapter on work-life balance, and it's such an important thing to me that I wrote like a 2-page kind of side note on it, and I call it the work-life pendulum, right?
mhm,
Because it's rare that I'm like perfectly balanced on any given day, right?
yeah,
Um, it's a pendulum, so there are days when I work too hard, and there are days that I spend a lot of time with my family, right? And
mhm,
if you work way too hard on that pendulum, your family's gonna, your wife's gonna divorce you, and your
mhm.
kids aren't gonna know you. And if you don't work and you spend all your time with your family and your kids, then you'll be homeless. So,
Right. You won't have a
you
house.
just want, yeah, you want to keep it somewhere in the middle,
Hmm.
not get divorced and not be homeless, and just hope that you're doing the best that you can to meet
Yeah.
everyone's needs and your own.
New life goal: be somewhere between not divorced and not homeless.
Yeah, there you go.
get get some matching
Yeah,
get some bumper stickers that say that.
there you go.
Um, all right, so I wanted to, we've done this interview before, or you and I have done an interview before. I've asked you the part two questions. Before I move on, though, is there anything else that you think we should cover when it comes to health for men in their 50s, things that they
Well,
should?
so I have an exciting new project that we were talking a little bit about before called Pilong.
Uh-oh, here it comes. Is it
And
possible?
yeah, I mean, is it possible to grow guys' penises?
Hmm.
And the short answer is yes. And the longer answer is, as a
What?
urologist and a
I hope it's a longer answer.
yeah, much longer and
Ta-da!
thicker answer.
Yes.
So, as a urologist and a sexual medicine specialist, I would see a lot of guys that came in who have tried other technologies for increasing the size of their penis
Hmm.
and met with disastrous consequences. Right. So you can do fillers, but fillers are expensive and they go away in a year or two, and you end up with a lumpy, bumpy penis. Or you can
Oof.
do fat transfers, which is expensive, and you end up with what I call a pig in a blanket penis. So a thick penis with a little head. Or you can use a traction device to stretch the penis, but you get a long, thin penis, which is what I call a pencil penis.
Mhm.
Or you can do a variety of different surgeries for penile elongation, but some of those guys are miserably unhappy and they end up with scar tissue and a non-functioning penis. So as a
Mhm.
regenerative urologist, I was like, there's got to be a better way. And so I created a protocol using what's called platelet rich plasma. So platelet rich plasma uses the growth factors that are naturally in platelets to help accelerate the growth of tissue. And then we use a traction device that was developed by the Mayo Clinic called the RestoreX device, and a suction device from Dr. Joel Kaplan. So the traction device gives you length, the suction device gives you girth, and then boost circulation and erections using the Affirm nitric oxide boosting supplement. And I did that study for 6 months.
Mm-hmm.
I got institutional review board approval. So, this was an official study. It was listed by NIH on clinicaltrials.gov, and I presented the results at the International Society of Sexual Medicine. So, this was presented in front of the scientific community. And what I found is that I could go grow over 6 months. I could grow guys' penises about an inch in length, about a half an inch in girth, and everyone experienced better function.
Wow. So, my question is to at what size should guys be at what size ranges should guys be concerned?
Yeah. So, the average American penis is like 5.1, 5.2 inches, erect penis.
Mm-hmm.
Um, and, at the end of the day, I don't really care how long guys' penises are, right? That's a personal choice. I would never tell anyone to make their penis bigger, right? As long as you're able to urinate and have intercourse, your penis is long enough,
Mm-hmm.
right? There's something called micro penis, which is if your erect penis is less than 3 inches, then you might have some problems doing those two things. But anything over about 3.5 inches, typically is not a problem. But the thing is, guys just want it. 300,000 women every year in the United States get breast implants.
Mm-hmm.
They don't all have breast cancer, right?
It's true.
There's no function of a breast implant other than for cosmetic purposes. And so, you know, one of the most common searches on the internet is how can I make my penis bigger?
Mm-hmm.
Right? It's something, if you survey guys, 50% plus of guys want a bigger penis, right? And so what I just tried to do is to create a way to do it safely and naturally and symmetrically
Mm.
at a much lower cost than the technologies that are out there. And so we created the P-Long study, which you can read about at p-long.com. And I created a network of providers around the country so that people don't have to fly out to California. If you're in New
Wow.
York, we have a provider. If you're in Canada, we have a provider. If you're in Texas, we have providers. If you're in Florida, we have, all over the country, we have providers. And it's, we don't judge people. If
Mm-hmm.
that's something that people want and, they have a couple $1,000 lying around, um, it's a great option
Wow.
for doing that.
Well, that's going to be huge. Excuse the pun. Um,
I hope so.
that's
Well, really what I want to do is to kind of get people, if they want to do it,
mhm.
to not do fillers, to not do fat transfers, to
Yeah.
not do
To do something that's
surgeries,
effective and safe.
to do
And
something that's effective and safe, and you won't regret
mm,
years down the road. And if it's 1,000 people a year that do that, great. If it's 5,000, if it's 10,000, if it's 50,000 people a year that do that, that's entirely up to you. I'm not here to tell you that your penis is not big enough.
mhm.
I'm here to tell you that if you're concerned that your penis is not big enough, or I got guys in the study. I had two guys in the study that outgrew the traction device. They
Mm,
started with pretty good sized penises and they just wanted it bigger.
hmm.
Guys go to the gym and get huge muscles. Like,
Right.
you don't, some guys don't, it's not like, oh, your muscles are big enough.
Yeah.
Some
It.
guys want bigger muscles, I don't judge them.
Yeah. There might
If
be
that's what's important to you, great, go
might
for it.
never be big enough. And
Exactly.
yeah. So I want to. Well, that's really cool to know. I want to ask some questions about being a doctor that or being in the medical field that that people might not understand that you maybe not as like an entire representative of the entire medical field, but I think a very respected and good one. What's something that you would like people to know, the general population, to know about doctors, and maybe the
I think,
struggles that they
yeah.
go through?
Well, no, I mean, so there's a video on the 21stcenturyman.com website,
Mm-hmm.
which is how to prepare for your doctor's visit, right?
Mm-hmm.
So if you go to the 21stcenturyman.com, all written out in letters, it teaches you how to go to the doctor. Because the thing is, what people don't understand is that, to become a doctor, you have to go to high school, college, medical school, which is another 4 years after college, and then residency, which is anywhere from 3 to 6 to 7 years. And then some people even do fellowships, which are
Mm-hmm.
even more subspecialized for another year or two.
Yeah.
So, you're 30 to 35 years old by the time you get out, and most doctors have hundreds of thousands of dollars of loans to pay off,
Mm-hmm.
right? And then the medical system is pushing doctors to see more and more patients in shorter and shorter periods of time.
Mm-hmm.
Right. So when they did this study on by Cerner, which is one of the EMR companies, the medical record companies, they looked at 100 million doctor visits, and they found that the average doctor visit was 16 minutes and 14 seconds.
Mm-hmm.
Right. So, you don't have a lot of time with your doctor.
Mm-hmm.
So what you really need to do is to prepare for that doctor visit.
Mm-hmm.
Right. So what you want to do is, first of all, don't talk to your doctor about sports. Don't talk to your doctor about weather.
Mm-hmm.
Don't talk to your doctor about anything other than you. Right.
Mm-hmm.
And then write down your medical history. You should have a document with your own medical history, your medical issues. Have you had surgeries? Do you drink? Do you smoke? What are your medications? You should have a list of all the labs that you've gotten in your life. Just put it in a
Mm-hmm.
book. You should have a list of all of the imaging studies that you've ever had, right? Put it in a book or put it in your computer, right? And then if you're going to the doctor for a specific purpose, write down your medical history, because that's the first thing the doctor is going to ask you. If, like, say you have a back pain,
Mm-hmm.
right? You should write down, well, my back pain started a week ago. It's on the left side. It radiates down my leg. It's worse when I'm standing. It's better when I'm sitting. I don't have it at all when I'm lying down. I've taken Advil. Advil seems to work. I've taken Tylenol. Tylenol doesn't seem to work. I had similar back pain 2 years ago and I needed an epidural. And this is the name of the doctor that did the epidural. And
Mm-hmm.
oh, by the way, I had surgery on my back 10 years ago because I had a car accident at that, all those
Are
details.
are these things mostly maintained by electronic medical records at this point, or are those things that you do need to keep track of yourself somehow?
I mean, are you going to rely on someone else to do that for you? Or say you're traveling somewhere, or
Personally, if something can be automated, I do rely on something else. So if it's not going
yeah,
to be
or
automated, then I should know about that, and I will
or
keep
if you
track of it
have
myself.
a lot of EMRs have portals.
Mm-hmm.
So print a copy of your most recent note, and that should have your medical, a good part of your medical history.
Mm-hmm.
But at least the part of why you're at the doctor,
Mm-hmm.
you should definitely write down as much about that as possible,
Mm-hmm.
and then write down questions. What are the
Mm-hmm.
questions that I want this doctor to ask for me, to
Yeah.
answer for me, and then hand that to the doctor. Because what people should know about doctors is that they're not mind readers.
Mm-hmm.
They're humans like everyone else.
Yeah.
They're not they have pressures and other responsibilities. They're not going to be up to date on every last little thing. If you bring an article from the internet, they may not have read it.
Mm-hmm.
um,
Yeah.
and they're being pushed by the system to see people faster and faster and faster and faster.
Mm-hmm.
And so, unless you prepare for that doctor visit, it's really unlikely that you're going to get your needs met from that visit.
Gotcha. Yeah, that's really helpful to know. I think because and many of us do prepare like a list of questions to ask the doctor, but we put it together and then we leave and they're like, "Gosh, we forgot to ask these two questions." So
Yep.
I think that advice of
Just
like
put it on a piece
giving
of
it,
paper and hand it.
that's
There
a
you
great
go.
idea. Well, that's really good information. I also want to know what are your struggles as a doctor that like people just don't, we don't give you enough patience for. Well, there's another pun. We don't give you enough patience for, or we don't, we don't give you, um, or maybe we don't like treat you as well as we could have because we what are some things that you're going through that we just don't get, like think of what is like a general conception of what a doctor is, right? I'm just going to put out like the worst one. Doctors are there to give you the right medication. They don't care whether or not you change your lifestyle. They just want to give you the medication, give you the next pill, and then send you on your way. Doctors make a lot of money. They don't care about you. They just want to get paid and then go home and do their fun stuff. Like
Yeah.
I've
So,
so that's
I
like
think,
that's the
uh,
worst perception I can paint.
yeah,
Like, so what should people
so I
know?
think, point number one is actually, fairly accurate, to be perfectly honest with you.
Mm-hmm.
Um, doctors don't focus on lifestyle because
Mm-hmm.
focusing on lifestyle takes a long time.
Mm-hmm.
It's hard to focus on lifestyle in 15 minutes.
Yeah.
Doctors have metrics that they have to hit, right? So your patients have to have good blood pressure. And if your patients don't have good blood pressure, then you get dinged.
Mm-hmm.
And so patients come in and you put them on blood pressure medication.
Mm-hmm.
Would it be better to talk to them about losing 20 pounds and start exercising? Yeah. But
Mm-hmm.
it's hard to do and it's hard to make those changes. So in order to hit that metric, you give them blood pressure medication.
So for
Right.
most people, your doctor is not going to be the person giving you advice on lifestyle.
Yeah. Oh, they'll say, oh, you should exercise more.
Mhm. But they're not going to guide that. They're not going to
You
like
should eat
break
better.
down your nutrition and your workout plan. And you're like,
I mean, the thing is like, and the other thing is like, I'm brutally honest
mm-hmm.
with my patients. I mean, I had a patient yesterday. I told him, I was like, if you don't lose 80 pounds in the next year and a half, then you're going to fall and break your hip because you have weak legs and a lot of edema. And within 5 years, you're going to be dead. And he just
Mm,
like stared blank. I said, you may not have heard that from someone before, but I've seen that a lot. And
mm-hmm.
that's what's going to happen to you unless you do something about it. Right?
Mm-hmm.
People are a little afraid of being brutally honest with people.
Mm-hmm.
We're not taught that in medical school, but I've evolved in that way. The other thing is I don't accept insurance as reimbursement.
Mm-hmm.
So I can spend more time with my patients. When I see a patient for the first time, I spend an hour with them.
Mm-hmm.
And I ask really personal questions. And I ask them, like if they say, well, I'm retired, how many times a week do you exercise? Maybe once or twice. And I'll say, okay, what's your roadblocks? How come you're not doing that, even though you know that you need to do that?
Mm-hmm.
Everyone's got roadblocks. And I don't think doctors really dig into why their patients aren't motivated. And a lot of it's because you got throughput.
Mm-hmm.
You don't have time to do that. Check blood pressure. Oh, blood pressure is too high. Here, take a blood pressure medication. You know,
Mm-hmm.
um, I can't pee. Okay, here, take a prostate pill.
Mm-hmm.
Uh, it's a lot harder to affect change in
Mm-hmm.
someone's behavior. You have to really understand human behavior.
Yeah.
In terms of money stuff, they did studies looking at physician the lifetime how much money doctors, lawyers, accountants, and like UPS drivers made over their lifetime, right? Because there's a huge opportunity cost in becoming a doctor. So doctors aren't making money really till they're 30 or 35 years old,
Mm-hmm.
whereas business people are making money when they're 25 years old, and lawyers are making money when they're 28 years old, and UPS drivers are making money when they're 20 years old.
Mm-hmm.
And so I think doctors came out really on the bottom of
Mm.
that study in terms of what are your lifetime financial upsides, and it just gets worse and worse for doctors every year.
Mm.
So I don't think you're going to see doctors driving Bentleys and fancy cars for too much longer.
Mm.
Most doctors in this country are employees now.
Yeah. Anything else you want people to know about
Yeah, I mean, I
doctors
think,
and
I know lots and lots of doctors. I went to medical school and residency with them, and for the most part, they're really, really good people, and they really mean the best for their patients. And if you have a bad health outcome, it's not because your doctor didn't care about you,
mm-hmm,
because almost every doctor that I know really actually genuinely cares about their patients.
mm-hmm,
It's because sometimes things happen, or sometimes you have to rush too fast and you miss things. um,
mm-hmm.
but I think in general, doctors are really well-meaning, genuine people.
Yeah. I mean, you'd have to be to, some of the work schedules. Like my dad's, my dad's a doctor. I've talked about this. He's an oncologist, and he left every day at like 4:30 or 5 o'clock,
Wow.
and he got home at 7:30. This is like every day, and now he's still, he's 64, and he's still doing that. He's getting up, he's going to work at 5 now. Instead of 4:30, he's going out 5. And he gets home at like, 6:30, 7 o'clock. And I call him on the weekends, like, hey, what are you up to? He's like, I'm at the office. I'm like, it's Saturday at 2 o'clock. Go home. You're in your 60s. Go enjoy your life. He's like, yeah, I'm working. So, you know, um, just crazy
Yeah, I mean, the
hours.
thing is, like, but when he's working, his goal is to help people,
Yeah.
and then he gets paid for that. Like my
Yeah.
friends that are on Wall Street, that are, do VC and all that stuff, their entire goal is to make money,
Hmm.
right? And they're judged by making money. Whereas doctors go to work to help people, and they get paid for it.
Yeah.
So it's a different paradigm.
Yeah. Well, cool. Thanks for sharing that with me and with us.
Awesome.
Um, I think that's a good ending point. So, do you have anything else you want to mention, or any stuff that people should know about you and where they can find you and learn more about what you do?
Yeah. So, if you're interested in our book,
Oh
The
yeah,
21st Century
we did
Man,
just add this. We're in the process of adding this to the Manful Yoga website, by the way.
fantastic. Yeah. I mean, the feedback that I get from the book is that it's transformative for men. There's really, it's the most complete, comprehensive, and medically accurate men's health book ever written. And it covers not just physical health, it covers aesthetics, it covers addiction, it covers lifestyle, it covers sexual health, it covers legacy. I mean, there's so many aspects of relationships,
Mm,
um, emotional health, mental health. It's all in there, and it's a book that kind of grows with you. And
hmm.
it's not a textbook; it's really an advice book.
Mm. By the way, I am in that book as well. I wrote a book. I wrote a section on
Yeah,
yoga. So
and mindfulness.
yes, it's been a long time, so I forgot exactly what I
Yeah.
wrote in there. I write a lot, but
Yeah. And then my supplement website is affirmscience.com, AFFIRM science.com. And that's where you can get our nitric oxide booster. We have a supplement called Support for testosterone. We have a supplement called Prelong for premature ejaculation. And we have a supplement called Spunk for prostate health.
hmm,
And then for those men who are interested in increasing the length, girth, and function of their penis, just go to p-long.com.
cool.
And then anyone that wants to see me as a patient, just go to Brandeis MD, BRANDEISMD.com. And I
Cool.
think that I got a YouTube, I got Instagram, a bunch of other stuff.
And there's a few TikToks of you dancing, right?
Uh, there are TikToks of me, but no dancing.
I haven't gotten there yet.
Yeah, no
Maybe
one, nobody wants to see me dance or
we
sing.
don't we don't know. They might. Maybe your kids might. Maybe they'd get a kick out
No.
of that. Someday. All right, another area of opportunity. All right. Well, Dr. Brandeis, Judson, thanks again for joining me on the Better Man podcast, guys. If you're listening in, I hope you got a lot out of this conversation. As always, I know I did, and I hope it inspires you to be a better man. So, thanks again.
Awesome. Hey, thank you so much, Dean. I really appreciate it.
Yep. Until next time. All right, guys, I hope you enjoyed that episode. Dr. Brandeis has an amazing resource that he compiled, including contributions from yours truly, called The 21st Century Man. This is an encyclopedia of men's health that you can use for years and years to come. This is a resource that I highly recommend every guy purchases. You can get this at the link in the description of this podcast, or just go to the21stcenturyman.com, all spelled out. If you enjoyed this podcast, I want to invite you to leave a review wherever you listen to podcasts, on Apple Podcasts, on Spotify, or Google Podcast, or otherwise. If you haven't already done so, please help me out. We're getting really close to 100 reviews, and I'd love to see us hit that milestone. Lastly, if you haven't already, one of the best ways to implement the kind of things we're talking about in the Better Man podcast is to get into a habit of consistent exercise. And one of the easiest ways to do that is through my Manful Yoga app and members area. This allows you to easily follow a program. Actually, we have a set path of programs now that you can use to do the workouts, to follow along at your own pace and get noticeable results within your first few weeks. We recently made some incredible updates to our Getting Started series, which basically is a 3-month onboarding experience to make it as easy as possible for you to start Manful Yoga and get results. You can learn more and sign up at mfy.tv/join. All right, guys. Hope this was a good episode for you. As always, I hope it inspires you to be a better man, and I'll see you on the next episode. If you like that episode, check out this other one right here. I think you're really going to enjoy it. If you haven't subscribed, click this subscribe button over here, and you can listen to the full episodes on any major podcasting platform. Full details below in the description.